This is a battle we actually have with the entire developing world, where we know there are some countries that have vaccinated well over 40–50% of their adult population, are now vaccinating even teenagers, and on top of that have surpluses, 40–50 million doses, but are still not ready to share that with the rest of the world. That is the height, like I said, of a nationalism that really has to be dealt with. And this is something we are fighting, and we're going to fight day and night until we ensure that there is equity in the provision of these.
Reuters gave these figures. They said during the last week reported, Kenya averaged about 7,306 doses administered each day. At that rate, it'll take a further 1,440 days to administer enough doses for another 10% of the population. How does that make you feel when the head of your vaccine task force says, we have the money to buy the vaccines, but we can't get them because they've been reserved by the rich nation?
One of the things that really has shown how unequal this world is has been the kind of vaccine nationalism that we have seen, where we have, and I've stated this openly and severally, worked together, you know, when they were doing clinical trials, when they were doing the research into some of these vaccines, and then all of a sudden, we find ourselves unable to access those same vaccines. And this is not just Kenya, it is basically the entire developing world. And I think this is something that really needs to be looked at, because the fact of the matter is nobody, not here in the UK, not in the United States, not in Germany, nobody's going to be safe until everybody's safe. And we need to be able to come up with a way of ensuring that there is going to be equity in the distribution of these vaccines.